Welcome, everyone. Hello, everyone. I'm happy to host this session with Dr. Sunil Anand. This is one of the speakers that we have at our conference on pediatrics that we will soon host starting on May 27th. The conference was previously a success, Little Pills for Little Ones, and now we have part 2. So one of the speakers that I have with me today is Sunil, and I will be your host today. My name is Anna Klikovac, and I am a homeopath and a teacher from Zagreb, Croatia. So send you all greetings from Croatia, from Zagreb. And we're welcoming today a great teacher and expert in pediatric cases, Dr. Sunil. So if you are now on phone with us from Canada, right?
From Toronto, yeah.
From Toronto. Okay, so broadcasting from Zagreb and Toronto to all parts of the world, hopefully, and thank you for being with us here today. So we're very happy to have you as speaker for the conference. If you can give us a little input on what is going to be your topic, and not to spoil anything for the viewers, but just give a little hint.
Yeah, sure. Anna, thanks for arranging this. So the participants who are on so far today would understand English, right?
Yes.
No need for translation. Yeah, okay, good. So, see, even by the time I joined the homeopathic college in Mumbai, I was also training simultaneously with my dad, who's a pediatrician.
Mm-hmm.
And this played a huge role in observing, diagnostics. And I remember once, we were first year students, so very excited about learning new things. And the giant stroke respiration was something that had stuck in my mind. And there was a kid coming in who was panting a little bit, and my dad said, "Get your stetho out and examine the kid, and what kind of respiration is this?" So he put me on the spot, right? So I was just a first year student, but it was a great way to learn. So there was anxiety because my dad is a very reputed pediatrician. So I didn't want to get it wrong. And I said, I thought about it, and I saw some distress on the child's face. And I told him, this looks like giant strokes breathing. Fortunately for me, he's not a very critical kind, but he smiled and he said, this is just normal breathing. Giant strokes would be when things are really out of hand, Sunil, and it's a crisis. So he said the first thing you need to learn, which in schools they don't teach very much, is you have to know what is normal to realize what is abnormal. So for me, this was a huge learning, and I recommend this to all my students, colleagues when I teach. And he introduced me to the book by Professor Illingworth, which is The Normal Child. So he said it's very important to know what is normal, and I think this is very important even for us homeopaths in particular, because we are imagining things. And often it's our delusion that we are looking at things which are absolutely normal, and we are trying to find rubrics in the repertory for what is normal, and by the end of it, we repertorize, and there's so many symptoms, but those are all common symptoms, So this, for me, I did not realize, but later on hindsight, when I look back, I think this was the turning moment when I realized when the homeopathic professor started teaching me PQRS symptoms, I realized that this is what Dad was saying, that see what's normal and then you'll know what is abnormal, or in homeopathic terms, peculiar, characteristic. And then this training went on, and the first year, second year, I graduated and I was doing my internship, and then there was a case in his clinic again of a young girl, and it was a very strange presentation of the look on her face. She had an umbilical hernia, and she was, her mother was carrying her, and this was a 14-year-old girl, very tiny. And my dad said, Sunil, what is the diagnosis? So again, he put me on the spot, but now I was a more, evolved student. So I looked carefully. I said, okay, let's just see all the features. I saw the tongue sticking out. I saw the small microcephalic head. I saw the umbilical hernia, the fact that milestones were severely delayed. I saw the protruded eyes, and I said, this looks something like a thyroid malfunction. And if I'm not mistaken, this could be a cretin child. And at that point, my dad was very, very satisfied. He said, absolutely, bang on, this is it. And, Sunil, I'm always there for you. And he's still alive. He's still not in very active practice, but available. But he said, from now on, going forward, I don't think I have to worry about you, because I think you've got the basic skills that are required to diagnose common things and abnormalities. So that was a big boost. It was a big help. So these were my initial years of learning pediatrics under him. And then, of course, Farooq Master played a huge role, because we were interning with him, and he was the chief medical officer at that point at our homeopathic hospital in Mumbai.
Mm.
So he would go through great pains to demonstrate clinical abnormalities to us, and this was a huge learning curve for me as well. But while this was happening, my father had two things in his clinic. One was on the patient side, it says speak, and the same placard on his side said listen.
Mm.
So again, I mean, as the homeopathy learning was going on, I could see that the importance of observation, subjective symptoms, signs and symptoms, and then Hahnemann starts talking about the same thing in the organon. And there were a lot of toys. Of course, he'd kept that to make the clinic children friendly.
And I know
And
you are very familiar with using toys, and that this is like your specialty
yes,
too. Can you tell?
yeah, yes. So I remember times where my dad, for example, he had a small little koala bear on his stethoscope, and the kids would be so fascinated that before they even knew it, he was actually examining them and auscultating them, because they were distracted by this little koala bear which had been stuck with Velcro on the stethoscope. So little tips like this I started gathering. My wife came along, who's a commercial artist, and she saw how can we use these and devise these methods and tools. So for example, if you see right here, if you see there, this is a smaller version of a children corner, right? So this is their section, and they feel it's almost like they are part of the clinic, but they feel safe and protected, and this is their area, their space. And I hide the stethoscope. I don't keep it easily accessible, because I want them to see me as a friend and not necessarily, or an uncle, or not as a doctor right away, and that keeps them at ease. It makes a big difference. But during that time, these toys were there, and so we share the same clinic space, me and my dad.
Okay.
So one small child came in with severe tonsillitis and pain in her buttocks. This is mentioned in my book, The 10 Ws, because this was my starting journey. So it's interesting you asked me this question about the toys. And she was going at a rapid speed trying to finish this puzzle and trying to put all the blocks. And every time it was like a self-imposed pressure. No one was telling her to do this. So while I was trying to gather data about PQRS and symptoms, this became more peculiar and worth a watch. So I decided to put my pen down and just look at this phenomena. And so the mother realized that I'm obviously, feeling this is important to watch. And while I was watching, I was seeing that she was extremely quick at what she was doing, and she was very creative. And the mom is a creative designer as well. So I said, now how do I have to give, I mean, I'd rather feel safe giving something like a belladonna or a hepar sulf or a mercury, because these are symptoms that, will help the abscess that she has,
Mm.
or silica maybe on her buttocks, and her severe tonsillitis. But here is this phenomena. How do I tie the two together? So then because it was my first glimpse into, what I refer to, or even in the sensation method, when we are talking of level 6, it's that the energy, it's the energy dynamics that, if you give importance and then of course verify it with objective data, you will be surprised at how accurate prescribing can get.
Mm. So what
So I
that
so I send yes, so I send the kid out, and and interestingly for me, there was a rubric. I didn't know even what to look for, but I just kept it, quick, speed, hasty, and I saw a rubric, quick to act.
mm,
So quick to act had coffea and lachesis,
mm,
and then I saw the other rubric, which was activity creative,
mm,
and this was only coffea.
mm,
But I wasn't sure. I said, I mean, how? So this is where Bonninghausen, in his own subtle way, was reminding me that you are on safe ground. But that's when the next journey for me started. I got the mother back in, and I said, okay, I have to now differentiate between these two remedies in my mind, of course. And I said, tell me about your pregnancy. And in the pregnancy, she said, I was so excited because I knew I was going to deliver. There was a time constraint, and I could only think at night. So I couldn't sleep, and all my thoughts would start coming in, and I would do creative things one after the other and get so excited about it. And this kid is the same. If we have to take her to a picnic, she can't sleep all night, and she's very low on her threshold to pain.
mm,
And I said, tell me more about the labor. She said the labor was horrible. I mean, after this, I think don't want to have another child because I thought I'm going to die.
mm.
So I said, why do you say that? She said, no, the pain was so horrible. So when I checked that again, you get mainly aconite and coffea again of fear of death during labor. So in the mother. So here I could see how the mother's state in pregnancy becomes important. And I could combine what I had observed in the kid and what happened in the mother and coffea. And I was very, very anxious, nervous, but also excited. And I shared this with the rest of the group, with, of course, Rajan and the others, that this is what happened. They said, wow, Sunil, so keep at it. And very next day, there was no call from the mother because I had requested her to call. So, I got nervous. Have they started antibiotics? So I called up on my own and said, listen, I want to know what's happening to your daughter. Oh, so sorry, doctor, we forgot to call you, but she's absolutely okay. The abscesses
Yeah.
have dissolved. You can
Okay.
swallow just one dose of coffea 200. That's it. So
Gave to
for
her.
me, I gave her, yeah, because at that point, we were not aware of the levels. The Rubiaceae
Oh,
family, one did not understand that understanding came much later.
mm,
I just gave it on the rubrics and symptoms at that time, but I gave her a single dose of coffea 200, and that was it.
okay. Perfect. Perfect. Yes, I know that you pay close attention to the observation. Really, you call method of homeopathy, and
Yes.
this is based on examples like. And I also that you had opportunity to work with the kids. Also, some of the cases in so analog doctors uh, would serve, and you have to the patients into. So, can you tell us any of the cases from your, something that you thought was really difficult and challenging?
Yeah.
Then, and you have competitors there
For sure.
think
For sure. For sure.
results in homeopathy.
In fact, of course, there have been very difficult and challenging cases, and as a group, we used to share these cases together. So the clinical meetings we used to have in Mumbai, sometimes we get stuck with a tough case and we'd share this with each other and we'd help each other out. And this was a huge time for learning for all of us, me included. But uh, when I was invited to join the CMP Homeopathic Medical College in Bombay, they said on one condition that, okay, you're junior, you're very young, but we like young energy, but will you be up to starting a pediatric OPD? Because they knew my dad was a pediatrician and now I wasn't ready for that because I wanted to teach, but teaching comes naturally to me because my dad has been a teacher and I enjoy teaching. But as a pediatric OPD, I had my reservations because I knew that the cases will be very, very challenging. But I said, well, this is it. I mean, if I don't, then I lose the opportunity. So in life, I've always seen that an opportunity comes, and if it's good and it's ethical, one should seize it. So I said, okay, give me a day. I spoke to my dad. He's been a mentor all along. So I said, what do I do? I don't think I'm ready. I mean, what if, there's kids who need resuscitation and intubation, and I'm not that familiar with that kind of thing. I'm not a pediatrician. I mean, I have some knowledge. He said, no, Sunil, they don't expect that. All they want is that their students are exposed to pediatrics, and coming from you, you definitely know more than any other routine homeopath. So I went for it. And right in the beginning, almost within 6 months of joining, there were some interesting cases, some good cases, and there was success in some of them. I got a case. This was a case of citrullinemia. And so the kid was constantly on arginine supplements, and if the kid wouldn't have that, this was a small kid about 1 year old, he would convulse. And again, I went back to my dad and said, this is the case that's come in. I'm working on it. I haven't started. He said, well, Sunil, if you can get this kid off, this is a metabolic disorder. I don't want to discourage you, but don't put in high hopes for the students and for the parents, right? Because you don't want to give them false assurances. But if you can reduce and finally stop the arginine supplements, then, I mean, I would be amazed. Frankly, I would be very, very surprised. And not only he, I, and all the others, we were surprised because what was happening in that kid was that this for me was the most peculiar thing. The mother was in a very distressed state because, as I told you, by then I had recognized the importance of the mother's history during pregnancy. When I asked her about but before that, the observation that I got was the child was almost like, in a delirious kind of semi-comatose condition. His eyes were hardly open. And from time to time, there'd be a gush of bubbling saliva coming out from his mouth. And I found this very strange. I said, is he convulsing? They said, we don't know. They're from a simple family. He could be, but this saliva thing keeps coming in. It comes in like a jet and then it stops. And wow, I said, this is interesting. But I didn't know where to look for it. It was just an observation at that point. Then I said, okay, can you tell me something about the pregnancy? And at that point, the dynamic in the room changed because her husband was present and there were all these students. It wasn't easy for her, but in India, people are generally more trusting with their doctors and with the homeopaths. So it makes a huge difference, as compared to the West, because it's tough here to record cases and, confidentiality is huge. And to some extent, I respect that, but the situation was different in India. So when I asked about the pregnancy, there was silence. I said, did I say something wrong? And I could see she was almost tearing up. And then there was a steel look on her face, and she looked at her husband who was behind among the crowd with all the other students who were standing, because this is a small little outpatient, very little crowded space. And she said, get out of the room. She told the husband. And this fellow very meekly put his head down and, he stepped out. And so I knew that this was a tension time and a difficult time for her. But she was okay. She didn't ask the students to leave, and she knew this was an academic institute and everyone needed to learn, and she respected that. But I salute that brave woman because she started speaking about her pregnancy, and it was all about her husband's infidelity and how he had mistreated her and how she'd almost committed suicide and gone onto the tracks. The word she used is, I wanted the train to split me into two.
Oh.
On the rail tracks. It's easier to access rail tracks back home in India than it is here, but but luckily the husband reached there because he realized she was disturbed and he was very apologetic for something that he had done years ago, but she couldn't forgive him, and he pulled her out and she got saved, but she was pregnant at that time.
Oh.
And then she started to hit herself, and she said, I remember banging, and then this kid at times when he'd get angry would bang his head on the floor and wouldn't realize that he was in pain. So that is when, and then she of course talked about a lot of dreams of snakes. Now this was tough for me. It was a pathological case. I knew I didn't want to give the wrong prescription, so I asked her to step out, and I asked the students. They didn't have a clue. They said, sir, this case, we don't know what. Cupromet, there's seizures, the opium, good prescriptions, but I said, no, something's not matching. And then I looked at the rubrics for the mother, not for the child yet, and I saw all the symptoms of Naja. And I could see the Indian cobra venom theme coming in very strong. And then when I opened Boricae, Materia Medica, I was amazed, Anna, by how Boricae had described the description of a comatose child, where he refers to it as a reptilian state and in a stertorous. So, stertorous breathing, very much like opium, right? So they were not wrong with opium, and that's what I was thinking of too, opium. If I hadn't been learning these recent advances in homeopathy, I would probably have prescribed opium as well. But, and then Boricae describes about the ejection of saliva from the mouth, and I knew I'm on the right track. And then this kid not only got better, but we could stop the arginine supplements, and he did great. So with this background of Naja in these so-called irreversible metabolic disorders, my confidence grew. And recently here in Toronto, I saw a case of Crigler-Najjar type 1. Now, Crigler-Najjar type 1, there's Crigler-Najjar type 1 and type 2. Type 1 is very severe because the enzyme that is responsible for conjugation of the bilirubin is absent. And because of this, the bilirubin is very high, and the child gets, like, we know, physiological jaundice, but this was not just physiological. The whole eyes were yellow. And in that situation, I had seen this kid, and that same ejection of saliva, and I could see in the mother the whole dreams of snakes. But interestingly, they disappeared because the husband wasn't very convinced about homeopathy, and sadly they discontinued for a while. And then again, I felt the need to reach out. Sometimes, our science is such that the ego has to be kept aside. And, I wanted to know, I wanted to know how the kid is doing. And I said, okay, I'll call. What's the harm? At the most, she'll say, no, we are not interested. Okay, my ego will take a little bit of a beating, but at least I'll know that I tried my best, right? So I called, and she said, so, thank you so much. And my husband is away. And you know what, Dr. Sunil, I want to give it a second shot, and I'm going to come again. So after 4 months, she comes again. And then she tells me, I kept telling my husband there was something happening, but I had given a Naja 30 at that point because, I didn't want to take any chances, right? When the kid came in a second time, again that ejection of saliva, the seizures. And then she said one thing just before going. She tells me he's got an ulcer on the below of his tongue. Now this is where medical terminology, coming back to normal and abnormal, and knowing, not only the pathology, but knowing where to find a particular symptom. Like, for example, if you didn't know that the frenum, R-F-R-A-E-N-U-M, is the part that joins the tongue to the roof of the mouth, you wouldn't know where to find this rubric. So I looked at mouth, ulcers, tongue, frenum. And only 2 or 3 remedies, and one of them was Naja.
Oh, God.
So, I was amazed. So this is fresh in my mind because it just happened recently, and I showed it to her. There was transparency, and she was amazed too. Wow, so we're on the right track. I said, yeah, we're on the right track in terms of the remedy for sure, but potencies, yes. So by then I had also arranged for LM potencies. Here it's not as easily available here in Canada. People don't practice, use it as much, unfortunately. So I have a limited repertoire of LMs here. But by then, knowing that the kid could do well with LMs, and it would be an easier way, I had got that, and we started the kid on LM 3. And then she gave me a feedback. Not only did the ulcers go, but I mean, even with the seizures, the kid was doing great. So all thanks to that initial case of citrullinemia.
Great. Thank you for sharing that. Great.
Thank you. Yeah, you're very welcome.
I can.
So,
You will present
yeah.
at the conference. Looking forward.
Yes, I'm looking forward. Yeah,
Okay.
me too.
I don't know. Perhaps some of the viewers can pose questions if they have questions, or can take them. Until then, I wanted to ask one more question.
Yes.
If you can share any of the challenges that you are facing now during the pandemic, many of the things were switched at some point where see all the patients live. So how is this your practice? You are the doctor, you observe, and
Yeah, that's a very good question, Anna. So, see, on one hand, really, if you ask me, this was a God-sent opportunity, not just for homeopathy, but for medical advances and for families where there could have been dysfunction to respect the fact that they have more time with each other and they can spend time with each other and they can give quality time to each other. But in most families, unfortunately, just the reverse has happened. Now, we haven't respected the fact that this, cosmos arranged time for each other. We should value that. We haven't done that. I mean, I'm sure some have, but most I've seen haven't. And there are many reasons for that. I mean, parents are stressed too. I don't blame them. They've lost their jobs. Partners would be away from each other, so that 6 to 8 hours time was welcome when they were going to their office space. Now they're in one roof, and they have to see each other and hear each other all day, and that this is something partners are not ready for, and this has
having the on Zoom school, so this is also different.
Yes, and because of that, on one hand, online education, has played a huge role, like how we are doing right now. This is great what we are doing, right? But on the other hand, what it triggered was in children who had addictive patterns, who needed stimulation. They learned that now they had access to online video games and internet, and this is not a case I'm planning to show, but I had sensed some questions could come up. Now, have a look at this amazing picture here. It's a drawing, right? Now, those who are familiar with the Hunger Games will see that this is a young girl who came in and was refusing to talk to me. She had eczema, and she wasn't even looking at me. She was sitting in that children corner there, and she was drawing this. I didn't even know she was drawing this. So she was drawing this and she was answering my questions. There was total disconnect. And when I started talking to her about her parents, she said, see, my parents are lovely people. And she was saying it in the presence of her mother. The dad wasn't there. But she had a younger kid who is on the spectrum. She was, needing to provide and help out with his care, and she was doing a beautiful job. But they were not understanding this 8 or 9 year old girl, and they were very rough with her, and they would question what kind of program she should watch. For example, Hunger Games is her favorite video, and she said they don't allow me to watch it. So this is her defiance coming through in the diagram, that you don't allow me to watch it. Okay, Dr. Sunil has asked me to do something here, and actually I've not even asked her. She just sat there on an instinct, and it was like a rebellion that I'm going to draw the very thing that you guys think are not good enough for me. So you can see how the video games and the online games has become a kind of a trap. But in homeopathy, interestingly, it's that very trap that becomes the solution to a problem as well. I didn't lose my cool. I could see there was tension in the room. The mother was awkward because she was being so defiant. But through this drawing, I said, I want to know more about this drawing. Can you get it? And then, the fact that someone was paying attention and felt what she was doing had value. And in a way, I was validating her. So I was validating her feelings, and through that, she talked about her eczema and how things bubble up and molten lava and explosion and outbursts. And it was all thanks to this drawing that the remedy she got was Hekla lava.
Mm.
So we don't see Hekla lava anywhere here. So, it's not that we are trying to say that through the drawings we will prescribe the remedy, but they definitely become an entry point which gets confirmed with other things and leads to the right remedy.
To the right remedy, yes.
But yes, just one more thing I'd like to add since you asked this question for sure. I mean, we are seeing kids fine motor skills developments which we associate, the 6 months, 1 year is absent. The reflexes are not as good. There is a definite attention deficit disorder. There is PTSD. They are not eating. They're not thriving well. They're not gaining weight. And I don't blame them, right? I mean, because the parents are scared. It's become a vicious cycle because the parents are in masks all the time. And this is what the kids are seeing. So they feel this is what is normal. So when someone comes in and is without a mask, in fact, they get, terrorized by this. So all this is playing a role. So for sure, I'm seeing the impact of this is going to be huge. We are going to have to deal with this for years together. What's happening in Ukraine and Russia and all over the world, that's not helping the situation. So there is tension, there is sadness, there's grief, there is lack of money. It's a tough time. So that's why I feel glad that at least as a homeopath, we can feel the sadness, but we can do something about it.
Yes, definitely. I was just a few weeks ago. There was like 10 people gathering together, and there was a mother with a child, and the child was like 14 months, clinging to a mother. You can see not comfortable, that she was scared, and then the mother apologized, and then, oh, sorry, my daughter is not used to seeing so many people at one place, and you all not wearing masks.
Right.
So
yes.
it turned out to be the opposite. The children become afraid you are not wearing masks.
Yes, absolutely.
Are being taught that this is a okay.
Yeah.
So thank you.
Yes.
I don't know if you have anything.
I see some questions here. I'm trying to read, but I can't read all of it. But I'm just going through this. So someone's asked something related to neonates in NICU, where allopathic medicine therapies like SSPT are continued. Okay, so how to assess the improvement? Okay, yeah, that's a great question. See, the moment we come into ICU, NICU, casualty, I think homeopathy has such a huge role to play there, but unfortunately, again, we don't see our presence there. So, but for that, we have to work as a team. I mean, an allopathic doctor present there has to look at us as an equal and say, okay, in this, if you can do something, and while we are monitoring, please, can you offer something? So this situation, frankly, of us being in these NICUs is very remote, but nevertheless, I mean, I'm a dreamer, and I have utopian views, and I hope one day we will all be together in such situations. So we have to prepare for those situations. So it again comes down to basic and great understanding of what to look for in terms of medical parameters. So sometimes we may think the kid is doing well. Like, for example, what was it, a case of, this was a homeopath, I don't want to take names, he was a well-known homeopath, and he was looking at the fact that the enzymes, it was a case of muscular dystrophy, if I'm not mistaken, And he was going and telling the parents that, oh, the remedy is working because the enzymes are coming down. And the parents believed him because they didn't have a medical background till they went to a pediatrician. Not my dad, someone else. My dad is very supportive, and he they love to refer cases to him because he always has our backs. So, but this pediatrician obviously, got irked and said, what nonsense. I mean, the homeopath doesn't know what he's doing, because if it's going down, that means, the enzymes, the muscle is wasting, it's crying, it's for starvation. And the homeopath doesn't see this. So things like this give a bad reputation to our science. So in the NICU, you need to be very sure the cooperation of the allopathic doctor, attending doctor definitely helps. But if you're not purview to that, you have to still this is where the themes of contact of the remedy on the skin, or this is there in the organon, of course, in certain aphorisms, and also the olfactory mode, where the kid is intubated and you cannot give anything, there's nil by mouth, so you can sniff, get the bottle close to the nostril, and even those things can help. And then you just have to trust the judgment of the allopathic doctor, because we are not working as a team here. But when they say, well, the situation is better and we can wean off, then now the problem that happens is that now, for example, say there's a case of SSP, subacute sclerosing panencephalitis. Now the homeopath is treating, the allopath is treating. Now the moment you give the right remedy, by the way, often zincum metallicum and cuprum metallicum come up in these cases because they encourage throwing out of the rash, which the exanthemata, which is suppressed, causes these neurological conditions. Now we as homeopaths prescribe the right remedy and there is a rash, which is expected. Now that's where the allopathic doctor, there's no coordination between the allopath and the homeopath, says this is not my department, the dermat needs to come in, and the dermat comes in and applies topical steroid and suppresses the skin. So we are trying to do centrifugal, and there's a centripetal. So we're just not seeing eye to eye, because he feels. Yeah, so I feel this is a difficult question to answer, but it's certainly possible. In our college, we have, for example, there was a case of Berger's disease, a chronic smoker, and I had prescribed Cical, and the patient was responding well. And fortunately for me, there was a good orthopedic surgeon in the picture, Dr. Mamtora. At the Mumbai college. He was monitoring the case, and he was at every stage, he was giving me feedback. The wound is healing, the ulcer is healing, we don't need to amputate. And really, this kid, this is a OPD case too. And just with Cical, I had not used LMs. I had no knowledge of LMs then. I didn't use any nosodes, which I would have liked to use, that could have quickened the process. But just with Cical, C potencies, the entire lesion healed, and there was no need for amputation. So this is the way for at one point the surgeon would say, I'm not seeing pink healthy granulation, Sunil. I'd like to see better pink healthy granulation. So please, if you want to increase the potency. He was so cooperative, and I'd say, yeah, sir, sure. He was senior to me. And that's the way to monitor and to get the best of. Maybe one day the other song or some other institutes will have spas like this, where there are multiple disciplines, seeing such patients together, and it would be a great opportunity for our students, our colleagues, and of course for our patients to be treated in such a facility.
To enjoy such treatment.
Absolutely.
Also always to see that world and to have that one day. Yes.
Absolutely.
Well,
absolutely.
Thank you for sharing this story. It was very lovely to hear them. We're looking forward to your presentation on Friday,
Thank you.
May 7th.
Yes.
Any of the viewers want to join the conference, feel free to post questions or contact the Other Song Academy, and you can easily register for the conference. Thank you again. will see you
Thank you.
and
Thank you, Anna, for coordinating this, and see you soon.
see you soon. Bye.
Bye. Bye, everybody. All the best.